Here we have Dr. Ashok Mehta, sir. He is the
Yes, sir.
director of the Max Hospital, Mumbai. He's a senior oncologist, and I invite
I'm
Dr.
a
Ashok
I'm
Mehta, sir,
surgeon. I'm a surgical oncologist at the
yeah,
Nanavati Hospital,
at
Nanavati
Nanavati,
Max.
at Nanavati Hospital. Yes.
Thank you, sir. Nice to meet you.
The communications, of course, are the most important part of interaction with anybody,
Yes, sir.
and with doctor and the patient relationship.
Yes, sir.
Uh, uh, when the patient comes to you,
Yes,
uh,
sir.
he will relate you to history. He will
Yes,
tell
sir.
you his own story,
Yes,
from
sir.
which you will make your clinical diagnosis, investigate, and
Yes,
treat.
yes, sir.
But during that phase of
Yes,
interacting with the patient,
yes, sir.
you have to communicate to him very clearly about the plan of investigation, the plan of treatment, the type of disease the man is suffering from, and
Yes,
whatever the questions he has to allay his fear, because the patient who comes to you has
yes,
lots of questions in his mind about the
yes,
disease, about the outcome of the disease, about the cost of treatment, about the drugs that he is going to receive, about the surgery that he has to undergo. In other
yes,
words, he has lots of queries. These days, what I do for communication, which is very simple with the current technology, I use my iPad. Of course, I talk to them, but when you have to explain to him about the disease, I
yes,
first, the most important, if somebody says that I've got pain in the back of my tongue and I find something wrong there, then you examine and then you explain to him, and then you have to show the diagrams that how far is what is the tongue like and what it
hmm.
looks like, and what is a cancer looks like, because I deal only with the cancers. So to explain to them, uh, I use the technology, especially I have an iPad, which is very easy to carry. It could be any other tablet or
Yes, sir.
even computer. And not only that, but suppose you have to explain to someone about the surgery, then we have the details of patients who've been operated before and the follow-ups. So we show them the intraoperative pictures, post-operative result, and how long that patient has been well. In other words, the communication is not only the verbal, but also through the diagrams and through the pictures, which is very important because it helps them in understanding and removing their fear. So this is how what I do normally in my practice, and which I'm communicating to you. If there are any questions, I'll like to answer them.
Yes, so that was very nice, your explanation, because the prognosis, the financial thing, like how the bill, about the cost of the process and everything is accurate. What you explained was wonderful. I wanted to know about certain experiences, because in hospitals, many times what happens is there is a gap in communication, because of which there can be many, like, near misses can happen. There can be some kind of misunderstandings, okay, between the patient and the doctors, or in between the colleagues. So I wanted to know whether any of you have experienced such things in your profession, regarding in your service.
Asking me
Yeah,
or
yeah,
somebody else?
yeah. So if any time you experience such misunderstandings or near misses, sometimes what happens is the doctor says something, the nurse understands something. When it is either over the telephonic conversation or direct face-to-face, one-to-one conversation, that can happen too. So has it happened anytime?
Oh, this can happen a number of times. I remember very vividly uh, a nurse making an error in a drug which has to be given only for 1 day, and the other drug to be given for 4 days, and she by mistake gave all the drugs for 4 days, and that caused a severe complication, and nobody noticed it. So
Yeah.
things can happen even if it's there in writing,
Hmm.
somebody's interpretation may be wrong.
Yeah.
So that is one way of looking at it. Sometimes we ask for one investigation and they do exactly that different investigation. Of course, it's all written down, but it's a question of somebody who reads and makes
Hmm.
an error.
Yeah.
Same thing may happen about the prescriptions. A little illegible, illegible writing, and you may have a different drug altogether. So I think there are plenty of ways in which you can be miscommunicating to a patient, to a nurse, to each other anytime.
Yeah. That is true.
Exactly. I would like to add one point over here,
Yeah.
over sir's statement. Can I?
Yes, yes, sure, sure, Amrita.
Yeah.
Sure, Amrita, go ahead.
So, as he said, the writing is the major issue in our medical line, right? The doctors write something, the chemist understands something and takes something, and the patient is a human body, right? So, we have to write a very legible writing that
Hmm.
not only the chemist but the patient also understand.
Yeah.
With the if we are not knowing what brand is it, we have to write the salt in it so that the chemist doesn't do the opposite. Because I still remember last week when I went to take medicine for my enzymes, my doctor wrote take salt that contains chyme, Q10, and lycopene, all those enzymes. On the other hand, when I went to the chemist, he just said that this is ketoconazole and
Hmm.
that has the same salt. So that was a totally different thing for me. So I thought, okay, if you are writing over the counter drug or something which is not permissible, fine, you have to write it like what are the enzymes in that. And also, as he said about the doctors and nurses,
Hmm.
sometimes there's some miscommunication because hospitals are totally full of patients these days. Not only these days, but before also. So what we can do is we can be more polite towards the nurses, and nurses should be polite to the patients as well.
Hmm.
Because these days I have seen, I'm in final year, I've been reading postings, and nurses are not only rude to the patient but to us also. So this is very much disheartening.
Hmm. So yours is a teaching hospital, teaching hospital, medical college and teaching hospital, Amrita.
Mm,
Yes.
it's the main hospital as well, we go
Mhm.
there to learn. Yeah.
Yeah, yeah, yeah. So that
Mm.
is one aspect because I am doing communications not only for healthcare hospitals, but we include the students as well, medical students, the professors, teachers, medical teachers, as well as the doctors, surgeons, the allied healthcare professionals. Everyone is included here. So yes, as sir told, yeah, that matters very much. As you told, politeness is also one of the factor. We need to be polite, even though we have so lot of stress looking after the patients. Then the administrative work, yes, teaching students. Then there are so many problems with the students also. Like students come us with different questions and all.
Yeah.
Everything is there, but in spite of all this, maintaining that calmness.
Yeah, but one thing is being a doctor, we've always been taught first the doctor patient relationship. I still remember second year first medicine posting. The doctors took 1 week just to explain what this is, and this is
Hmm.
important. But when I as a patient goes to another hospital or somewhere where we are here, so the doctors do treat us differently. One thing is they do not listen properly,
Hmm.
एंड दे जस्ट थिंक ओके ये दिक्कत है इस वजह से ये पेशेंट आया है इसको दे दो इसको भगाओ दैट्स व्हाट इज हैपनिंग दीज डेज इन गवर्नमेंट प्रैक्टिस particularly, not in private they do give us some time, but in government they have to be like give some time to the patient, not 15-20 minutes but at least 5 to 6 minutes. Every patient should have that, you know, importance.
Yeah. So recently, today only, I found an article. Today's article. There was an article where press release was there that in India we have 13 lakh 5,000 some doctors. Okay, now so we have the population around 21 crores. So 21 crores, we have 21 lakh, 13 lakhs patient doctors. Okay, and apart from that, around 5 to 6 lakhs Ayush doctors are there. So it doesn't even suffice. So crowd management is again a problem in the
Yeah.
hospitals. So that's why what
So
you
you
said
see,
now,
the
so
doctor-patient
देखो और
relationship
बताओ.
is not the only thing in healthcare.
Yeah. So
It is the
crowd
whole universe,
management
the
is
other
there,
universe.
maintaining the crowd. Each consultant will be having a long queue of patients, and then that consultant has to give equal attention to each and every patient, and that's what the patient expects. You know. So at that time, as you said, that इतना सारा crowd है government hospital में जैसे तुम बोल रही थी, you know. So that can happen. So that is what we are discussing, like how to manage it through communication. Now let me tell you my experience when I was an administrator in a hospital. What happened once, there was some miscommunication, and there was the fault of the billing department, and there was some wrong miscalculation maybe there or something. The bill was given, a huge bill was given, and when the patient found out that there is some mistake in the bill, and then what happened was that patient was a PA to some minister, and now the things became very complicated, and the patient and the relatives, they all came to like there was a violence in the hospital, and they came after the director of the hospital, and the director closed the doors and sat inside his cabin, and now it was my responsibility to handle the crowd. It was very difficult, you know. So that situation where that patient was a PA of a minister, and then I had to handle it in my polite tone, and to explain them that our director is a surgeon, and then he has to look after so many surgeries, and it is not his fault that the billing is wrong. And then I explained him in a very polite and nice manner, so that they understood the situation, and they waited till the bill was done correctly, and then everything was solved, you know. So these things happen. So that is what I want you to explain, if you have experienced any such other things. Is over to Dr. Ashok Mehta, sir. What do you say
Yeah.
about these things, sir? Many
Look,
times.
see, if you are in a public hospital,
Mm,
uh, you are under different kind of pressures. If you're
yeah.
in a municipal hospital or in a government hospital, then, even the corporators, the legislators,
Mm,
and all those people have some patient or the other, and they want everyone to be treated, them to be treated in a
equally.
different way.
Yeah.
Yeah. I think one has to face it. There's no way. There are sometimes the violent people, some people shout at you, some people are, use a language which is not very good. So I think one has to accept that in public hospitals, uh, I think there are both ways. The patients also are often don't get a proper treatment, and even the staff doesn't get a proper treatment. So I think communication is a very vital link in between the two. We need to have people who can handle difficult situations, where they can use their persuasive power
Mm,
and do the,
yeah.
try to sort out the matters. Matters are normally very simple, but
Yes.
they are complicated because everyone is very excited and nobody is willing to listen to the other man. And sometimes we are not able, we are not in a position to say sorry also. I think it's a very important thing. If something has gone wrong, to accept that things have
Exactly.
gone wrong.
Exactly.
We are willing to correct.
Exactly.
Like
So
in
that's
a
what.
wrong bill or something of that kind, you refund them immediately, and that should solve the problem.
Absolutely.
But then, to ask them to come back after 2 days and 3 days and call them, that's not proper.
Absolutely.
If you, if somebody has by mistake uh, paid, say, 1,500 rupees more than what was expected, it should be refunded.
Correct. This is a very beautiful thing, soft skills like saying sorry, please, thank you. All these words are very important. And there are very simple things because of which people may get excited and then things get complicated. So, solving these simple matters, keeping the egos aside, and understanding the patient's needs or understanding the other doctors or subordinates' needs is also very important. This is a very good point you have mentioned, sir. And I would like to ask one more question, and I would like to like this to be answered by everyone according to your own perspective. So I want to know whether the hospitals, because the basic roots are from the medical education, where we are taught all the subjects, but soft skills is not taught to us as a subject. So, is it necessary that soft skills should be taught to us, like how to manage communications with the patients, how to manage communications with the subordinates, and all that, and what should be the verbal skills, the body language, okay, written communication. So, is all these things important for the students to learn and the professionals to learn? So, what's your perspective, sir and madam?
सॉफ्ट स्किल तो थोड़ा मस्ट है, पर कहीं कहीं थोड़ा सा रखना पड़ता है.
Hmm.
सॉफ्ट स्किल तो मस्ट है.
Okay. Yeah. So, I would like to ask you whether it should be included in the curriculum, medical curriculum.
It should be included.
It should be included. Yeah. So, it will affect the total personality of the doctor as well as his professional skills. Sir, what is your view
It will
about
be
it?
affect. It will affect it.
Uh, Dr. Ashok Mehta, sir, what is your view and perspective about this?
I think it's very important, but the question that you asked about soft skills, I think the world has changed a lot since olden days when we were all going for physical training and but today with the last experience of a couple of years of COVID,
Yeah.
we have now better ways of communicating through the Zooms, as we are saying, and training in soft skills can be done through the internet, through this medium. For example, we are a medical wing of Raj Yoga Education Research Foundation of the Brahma Kumaris. We have a beautiful program we call Values in Healthcare, a spiritual approach. VIASA, that's acronym. It is a personal and team development program in which we have what we call a facilitated experiential program. This program was initially started with the purpose of preventing the burnout amongst the doctors. The key principle was the doctor heal thyself. You try to heal the patients, but in bargain, you are going through a lot of mm, uh, burnout, a lot of stress. And therefore, we developed this program. And this program has 8 modules. Basically, we are talking of values which make our life valuable. It also focuses on the purpose of our life. Why did we take to medicine? And essentially, how to be peaceful, how to be positive, how to be compassionate, how to be cooperative, how do we take care of ourselves, valuing yourself. We are one of the rare ones in the sense we are in a small, minuscule trained personnel as healthcare professionals, which we should take care of ourselves.
Yeah.
Sometimes we don't understand our value. It's very important that we take care of both our physical health as well as psychological and social health. And therefore, and then the role the spirituality plays in this kind of value-based training, the soft skill development, and the role of how we can always have a resilience when we are stressed. How do we come out of it? How do we come out of a a accident, or I come out of pressures of work or failures. So many things can go wrong, and then how to come back to near normal. So I think this soft skill development is the same as I would say is the values in healthcare. And
Absolutely.
in and the most important thing is to take care of your personal and professional life, to bring values in your own life,
Absolutely.
how to be peaceful, how to be positive, how to be appreciative of others. And we use what we call the spiritual tools. Spiritual tools are reflection, meditation, and deep listening, visualization, creativity and play, appreciation. All these are, I can always dilate upon them, but the most important part is to drive home a point that soft skill development by which we can make our life more enjoyable, more purposeful, and give the best from our side to the patient and protect our own health.
Absolutely.
So soft skills are absolutely, in my opinion, absolutely essential. And these days, I think one can develop them without physical presence of the people. It can be
That,
done on a net,
that's true.
online.
That's wonderful, sir. Like when you said that physician heal thyself, once we heal ourselves, when we are full of values, ultimately the soft skills will be present in us. There's no need of learning it. But the question is that we whether to include soft skills in the medical curriculum or not, whether the student should be trained with the soft skills along with the vihasa. Vihasa is also one part of that only, as you said. So whether to include this in the medical curriculum, at
See,
least
that,
1 hour per week, so that they should be trained that this is the part of your profession. Because hospitality industry is always thought to be polite with the customers and all that, and doctors, there are certain issues, why I don't know, but the violence happening in the hospitals, there is both sides. There may be a fault, but it happens. So to avoid violence in hospitals and errors, communications should be clear. So whether to include it in the curriculum or not is a question.
Rajeshwari, the curriculum is a very interesting thing.
Mm,
At one time,
mm,
we wanted to introduce basic approach to cancer, treatment, something about the cancer treatment and cancer diagnosis. And they said, oh, sorry, we don't have any time, there's hardly any time left in the curriculum because every specialty wants some training to be done to the students in their area. And there are so many specialties developing now. So we cannot uh, introduce this kind of something in the syllabus, they call it. So
okay.
I think this soft skill development you may not include into the curriculum,
Mhm.
or but it's a part of the training. If it's a voluntary thing, it's an optional thing, you may give them an extra weight while appointing them as a resident staff or whatever, or
Mhm.
promotion. So somewhere down the line, you have to acknowledge that if you have a training in the values, we value you. We give you, if two people are equal things, we give a little preference to the one who has taken training in the values.
Yeah. Yeah, we are running short in time. 10 minutes are left. Yeah, one question I would like to ask is, according to my experience, when I found that when I was teaching in the college, I found that there are many students who know the answers, but they are not able to tell in the vivas. Okay, when we ask them, yeah, we know it, but they are not able to express it. Now it may be because of fear, or it may be because of the Maybe it's because they don't know the language or to speak in English. So these things also happen with the students. Now the same thing continues even after they pass out, because what happens, vivas, sometimes there is a leniency and most of the students are passed in the vivas because we know that they are writing well, they are good students. Yeah, but the same thing happens once they pass out of, and they go after passing out, this they serve as the doctors. That is where they find the difficulty. Now, Kulwinder ma'am is also a professor. Have you experienced such things, ma'am?
मैम ऐसा है कि अभी मैं तो लेक्चर लेती हूँ, तो लेक्चर के दौरान मेरे को कोई ऐसी प्रॉब्लम नहीं आती। मैं तो लेक्चर लेती हूँ, बच्चों से इंटरेक्ट करती हूँ, और पहले हम बताते हैं, बाद में इंटरेक्ट करते हैं, तो दे रिस्पॉन्स अस। अगर उन्होंने रिस्पॉन्स दिया तो हमारा जो है लेक्चर पढ़ाया हुआ हमें अच्छा लगता है कि बच्चों ने ध्यान से सुना है, तो ये अच्छा लगता है।
So this happens with everyone, or there are some students now out of 100 batch. Usually there is 100 batch of students. So we find that at least 10 students are those who are good in studies, but they're unable to speak. So that is where these 10 students who will pass out and become
This is
doctors.
because of if they are not unable to speak because of the stress, because of the little fear inside them.
Yeah.
कहीं हम गलत ना हो.
Yes.
This
So
is
what do you do to remove that fear, and what happens is this fear remains with them. This fear remains with them forever, and even after they pass it and become doctors, that fear is still with them, and that is where the problems arise later in the profession. So this is where I am going to find the solutions. So how to remove this fear in communication after they become doctors?
इसके लिए तो मैम थोड़ा प्रैक्टिस ही करनी पड़ेगी, बार बार जो है अपने आप को रखने का पेशेंस इसमें बहुत चाहिए.
Patience चाहिए. What is your perspective, sir? Mehta sir.
I think the communication skills are very important, and everyone cannot have the same level of skills. You have to practice it. In other words, what we used to do, for example, when we appeared for exams, we used to go to our registrars or to our bosses and used to make a presentation. He would ask you a question and then again you answer. It's a question of practice.
Yes.
Any skill that you want to develop, you must do it more frequently, and you can do amongst yourself, one student to another student also. But you should be aware that he needs to develop that skill.
Yeah, so awareness is very important. Awareness regarding I should need to develop my communication skills, and this is going to help in my profession in future, and it will avoid certain problems. It will avoid certain complications. That is what is the awareness which is needed by each and everyone in the hospital and healthcare department in the profession.
As a matter of fact, a doctor is a leader in the
Yes,
society,
he's a leader.
and therefore he should have something more than only the training of medicine. Training to communication, to have a good image, whether it be properly dressed. He should be very gentle in his approach to the other people. Cannot talk loose, because if you talk something loose, people may misunderstand it. You may think you are joking, but that may convey a wrong impression. So I think other skills are either you learn by yourself or you have to be taught. See, in our time, well, I was a medical student in between 55 and 60, there were less number of students. And even as postgraduates, we were few people in a unit. Today, there are 15 people in a unit. I mean, you cannot get that attention. So I suppose you have to take care of yourself. Either taking training or being aware of it, that you need to be, taking your self-training.
Thank you, sir. Thank you, sir. That was great. A doctor, a leader is a very good point. Yes, he is, because once he goes into the society, he is looked upon, and his each and every word, his communication and his behavior, everything matters. That's a wonderful point. We were expecting Pranav also, Pranay Pardesi, and he is not joined our meeting today. Yeah. and within 5 minutes of meeting is going to end. That was a wonderful session, sir, and I really got some beautiful points here. And I think I will continue this in the next session, maybe within 10-15 days.
Okay.
What do you feel, sir, about this?
It's a very important that we give time to the patient. Most of the time, the doctors are not able to give enough time to the patient because he is involved with too many things. The patient care should be focused for patient care. You can't be doing 10 things at one time. I still remember that every patient who came to my unit in Tata Memorial, this was for 25 years back, I used to see every patient who carried my stamp, because in cancer, if you say that nothing can be done, is like a life sentence, death sentence. And therefore, every patient I used to see and make a decision. Different people may operate, but the decision-making process should be, nowadays we call the tumor board and all that, but it's important that you communicate individually to the patient.
Yeah, communicating individually one-to-one is very important.
Not only in our country, not only the patient, but the relatives also, the close relatives, wife or parents or whatever, they are involved in the care of the patient. So, but unfortunately, what happens is in a public hospitals in our country, there are too many, poor people, and therefore, we take them for granted and we don't communicate properly. And it's again always shunting the patient from A to B to C to D. You just send them to another opinion, and patient gets lost in between. So I think that there are lots of things need to be looked into, and I'm sure that simple things what you're doing today, you may come out with some solution which may be very important.
Yeah, I'm trying to find out the solutions, and I'm trying to find out how communications will work wonders in this transformation of the healthcare. And hope so within few sessions, and with such honorable and respectful people, with having so much of experience in the healthcare. I would like to interact with many other professionals also in the healthcare. Thank you, sir, for being here. And I would like that if you invite many more people like you to interact in these sessions, I'll be very much glad.
Sure. Thank you.
Thank you so much.
Bye.
Bye, sir. Om Shanti. Good night for being here. Good night, and thank you.
Thanks.